Hi there, I am Dr. Tan Yia Swam of Breast Friend Surgery and Wellness. I'm a breast surgeon specializing in any kinds of breast lumps, nipple discharge, interpretation and normal scans, and breast biopsies. When you do your own breast self-examination and you pick up a lump, I always tell my patients, do not worry, do not panic. There are many explanations for breast lumps. It can be something as simple as your normal breast tissue being a bit more swollen during your periods. It could be hormonal changes such as a fibroid or a cyst, and of course it could be a cancer. So if you do feel a breast lump, call your doctor and make an appointment to get it checked out properly. If you ever feel a breast lump, I always tell patients, do not worry, get a professional check. Even when the patient sees me for the first time, there's a very long introduction and history taking. I need to understand the patient's risk, the likelihood of this being a cancer. We still need to order the necessary scans, such as a mammogram, an ultrasound, and most importantly, a needle-guided biopsy to verify what kind of lump it is. Out of all the different possibilities, most lumps are non-cancerous, but we also do not want to be too relaxed and miss out a cancer. So after a patient had the necessary scans and biopsy, we will have a diagnosis. Generally, for breast lumps that are non-cancerous, there is the option to just monitor closely. Some lumps may grow over time, and it will be good to remove it so that we don't get it too large. For patients who have a cancer, yes, we must proceed with the necessary treatment. Treatment will be a bit more complicated. It will comprise of surgery. Some patients need chemotherapy, radiation treatment, and hormonal treatment. In general, as a breast surgeon, I will offer all the different options to the patient and personalize it according to what the patient needs. Nowadays, some patients can make do with a minor surgery called a lumpectomy or wide excision. For some patients, they will need a mastectomy, which involves removing the whole breast. However, if they choose to, they can have a reconstruction, which involves getting a plastic surgeon in to fix a new breast back for the patient so that she still looks and feels like her normal self. I think that a personal approach is very important. Most of the ladies I see will share that it is a very private area and it means a lot to their identity as a woman. So in the first consultation, I will always take a bit of time to get to know the patient a bit better as a person, to understand her needs and concerns. What stage of her life is she at? All these affect a woman's sense of well-being and decision-making, whether or not to proceed with surgery or treatment for breast cancer. So in the private sector, a lot of patients will usually Google online, read reviews, and try to find a doctor that match their personalities and can look after their needs and wants. So whenever women find a lump, I keep telling them, take a little bit of time, a few days, to ask around, get a good recommendation. But what's most important is, when you meet your doctor, have a good, honest conversation and see whether or not the doctor is best suited to help you through your journey.